Every day, children who are eligible for vaccination visit a health facility but leave without receiving the vaccine doses they are due. These missed opportunities for vaccination, or MOV, contribute to the under-vaccination of children. But there are ways to reduce MOV and vaccinate more children simply by improving the services they are already accessing. In order to identify the most effective interventions, it is important to understand the reasons behind MOV. These may relate to health worker or caregiver behaviors, or they may be due to broader health system issues. In this video, we will look at interventions that address health system issues. To begin, what are some specific reasons for MOV that relate to health systems? One reason is a lack of integration between immunization and other health services. For example, non-immunization staff who treat children are often not trained or allowed to screen home-based records and to provide or refer for vaccinations. Another issue that leads to MOV is stockouts, or a shortage of vaccines and related supplies. With limited vaccines, more people will leave the health facility without being vaccinated. Stockouts of home-based records also cause problems. Without them, it is difficult for caregivers to track what vaccines their children are due and for health workers to screen for eligibility. Health systems can also increase MOV by limiting the hours or days that immunization services are available. There may also be a lack of awareness or misunderstanding about upper age limits and catch-up policies for vaccination. Health workers may think it is too late to give any missed vaccinations or that children over a certain age are no longer eligible. Finally, health systems may use poorly designed home-based records. If they are difficult to read or if vaccination information has been entered unclearly, they are unlikely to be used effectively by either caregivers or health workers. Now, let us review some interventions to address these issues. Health systems can enhance training, provide job aids, adapt health system practices, expand immunization services, and promote national guidelines. First, consider ways to enhance training for health workers. Integrate basic immunization principles into pre-service and in-service trainings for all staff. Trainings should cover how to screen a child's vaccination status to determine eligibility, how to read and fill out home-based records and immunization registers, and how to counsel caregivers about the importance of vaccination. All staff should be familiar with the National Immunization Schedule. If health facilities are experiencing frequent stockouts and shortages of vaccines and related supplies, provide training to improve data recording, stock management practices, and vaccine forecasting. Continue to reinforce these skills through supportive supervision. Next, job aids can help address different health system issues. Consider job aids for non-immunization staff that remind them of the immunization schedule and to check home-based records. This poster provides an easy reference for which vaccines can be given at each age. And when screening home-based records, health workers could use alert stickers to identify children due or eligible for vaccination. These stickers can help remind the caregiver ask for their child to get vaccinated. They also remind any health worker to check the child's vaccination status until they are fully up to date on all recommended vaccines. If stockouts of vaccines and related supplies are a persistent issue, provide job aids and tools to improve vaccine forecasting, such as the WHO Vaccine Wastage Rates Calculator. Another way to reduce MOV is by adapting health system practices. To integrate immunization and other health services, first, try to improve accessibility and visibility of the vaccination area. If possible, move the vaccination area closer to the waiting room. Or improve the visibility of the vaccination area with bright posters or with bold arrows on the walls or the ground. Consider providing screening, vaccination, or immunization education in the outpatient waiting area. Establish a cross-referral system between vaccination and other services. For example, when curative service staff identify children missing vaccinations, they could give parents a coupon or token like this one, referring them to the vaccination area. Another strategy is to have immunization staff share the defaulter list with staff from other preventative and curative services so they can help track children missing vaccination. Health systems may need to look for ways to expand immunization services. In order to increase opportunities for vaccination, try to establish or support a national policy on conducting daily vaccination sessions. This will allow caregivers to schedule visits that are more convenient for them, or extend the hours that vaccination sessions are offered. Finally, promote national guidelines that can help reduce MOV. Reinforce policies about upper age limits for vaccine eligibility, providing vaccination anytime an eligible child has a health visit, even if that means opening a multi-dose vial such as measles and BCG, and if applicable, reinforce the national policy on conducting daily vaccination sessions. These policies can be reinforced through WhatsApp or letters to all health workers, as well as through supportive supervision. Now, you should be familiar with some strategies for improving health systems to reduce MOV.